Hi, my name is Jennifer Stansel, and today I'm going to be talking about the different kind of monitoring devices that you would use on a patient while under anesthesia. The first one we're going to talk about is the pulse oximeter. A pulse oximeter is basically a machine that measures the oxygen-saturated hemoglobin in the blood. It basically shows us how well the lungs are delivering oxygen to the rest of the body. So ideally, we would like it to be in a range of 95 to 100%. Anytime we go under 95% for our SpO2, that's when we'd want to notify the doctor. To use a pulse oximeter, we want to place our probe on some kind of mucous membrane or thin tissue. So a couple of places that we can put a probe is on the ear, the tendon, the inguinal areas, prepuce, vulva, or we can also do it on the tongue if we're putting it on the tongue or any of these other places we want to try to avoid areas with pigmentation. On my video of my dog, you can see that his SpO2 is at 98%, so he was good as far as oxygen. The next thing we're going to talk about is a capnograph. Unfortunately for me, I was not able to get a hold of a capnograph for my video. My clinic that I work at, my shelter that I volunteer at, did not have them, and the places that I tried to contact as far as getting a video did not want me videotaping a surgery, but I can go ahead and explain to you what a capnograph is. It is a machine that measures the CO2 levels in the air that they're breathing in and out, and it's a good way to monitor CO2 levels in the patient without needing a blood gas analysis. Our ideal range is usually around 40 millimeters. And we also like to monitor the end-tidal CO2. We will normally alert a doctor if this is decreasing or increasing abnormally. And the way that you would use this machine, even though I don't have it, I can show you on my video, is that you would place it between the where the endotrache tube connects to the breathing circuit. The capnograph sensor would go there, and then that way you would be able to monitor the CO2 going in and out. Our next machine is an esophageal stethoscope. Using this, we can measure a patient's heart rate from a distance, so we don't have to be right up next to the patient or near the doctor's drape or sterile area. When we are using this, our ideal rate, since we're monitoring heart rate, is around 80 to 120 beats per minute in a dog and 100 to 180 beats per minute in a cat. My cat in my video is a little high. You can see that she, with her stethoscope in, the machine was reading it at around 196 beats per minute. And as far as using this machine, we lube it up and then we place it through into the esophagus down to the level of the 5th rib. Our next machine is an ECG machine. It monitors electrical activity of the heart, and it helps us identify arrhythmias. So the tech's job as far as using an ECG is being able to recognize rhythms and sounds coming from the ECG and notify the doctor if it's abnormal. You can see in my video the ECG on this dog looked very, very normal. There was nothing really abnormal about it. As far as placing the leads, you always want to try to make sure that your white one is on your right arm, your black is on your left arm, and your red is on your left leg. In my video, we use all 4, and we put the green on our right leg. Another very important machine to have and use while doing anesthesia is a blood pressure machine. So by checking a dog's blood pressure, we are monitoring the adequacy of blood flow to the tissues. Our ideal blood pressure is 120 over 80 milliliters. And at minimum, it would be 80/40. Anything below this is when you would notify the doctor. And these blood pressure machines basically can measure systolic and diastolic pressures. My machine that you see us using in the video is an oscillometric. I'm not sure if I'm saying that right. And basically I just put the cuff on the patient, and it uses a internal pressure sensing bladder to blow up the cuff, measure the pressure, and then send it back to the machine that we were using. Another machine that we like to use is a thermometer. A big thing that can happen with patients under anesthesia is that they will become hypothermic. So using a thermometer, we monitor the body temp and we try to make sure they don't become hypothermic. On our machine in my video, you can see that we are using an oral thermometer, but we also intermittently use handheld thermometers and insert them rectally into patients while we're doing our anesthesia. Our ideal temperature is around 99 to 100 degrees. If it gets under 98, you want to notify the doctor. And last but not least, heating devices. Heating devices are very important because of what we just spoke about, which is hypothermia. We want to use heating devices to prevent hypothermia. That being said, we also want to prevent not burning our patients. So a good precaution to always use is to put some kind of blanket in between the patient and the heating device. If a patient ever goes over 101 degrees, you should probably notify the doctor and decide if you need to turn the heat down on your heating device. Ideally, we would want our patient to be around 99 to 100 degrees. In my video, you may not be able to see it very well, but there is a circulating water blanket or circulating water pad underneath the patient. And in the video where you saw the esophageal stethoscope, that was a heated table. Thank you very much.